right, buddy. Oh, good boy, easy. All right. Cool. All right, so this is Monk. Monk is a new patient for me. I've worked on his owner's other horses already this morning. There was 2 other ones, and he is her 3rd. I don't have a whole lot of history on him. Over here. Let's see, I think he's probably about 10 years old or so. He was a little skittish when I first went up to his stall and put the halter on him, but seems to have calmed down really quickly and really nicely. So I'm just jumping right in. I like to check their pelvis first and work my way forward. So he's kind of pulling away from me here. Oh, buddy. Come on, come on. So with the new horse, I really don't know, what their tendencies are, what their history is, other than the little bits that the owners give me. And usually if I'm working on a horse for the first time, the owner is here, so I can ask those questions. But if they're not here and it's a first time horse for me, then I give the horse a little bit extra time, trying to figure him out. Just see what he's comfortable with and what he's not comfortable with, and just really give them that extra time that they need. Oh. So far, he does not feel like he has any back pain at all. He's a little heavy, but I'm assuming this is a newer purchase for my client, so I'm sure he'll be back in shape in no time. Oh, good boy. Good boy. So always on a new horse, it's important to take your time, especially when doing these reflexes, because you really don't know how reactive they are. Good boy. Ooh, that's really nice. That's really nice, buddy. That's really nice. So sometimes when you hit the reflexes, they can be super jumpy. They can be very sensitive to them, and once in a while they'll kick out, but it doesn't happen very often. But you do want to be careful the first couple times you do them, just to make sure that the horses are okay with them and they're not too sensitive and jumpy where you're going to get hurt. And these pressure points that I'm pushing on are part of my equine stretching masterclass on my website at sporthorsechiropractic.com. So if you want to learn precisely how to do these with step-by-step video tutorials, check that out. And I'm also writing a manual, an equine stretching manual, that's going to be available as well, hopefully by the end of the month. It'll be available on my website, and I'll have it in all the descriptions on my YouTube videos and on my social media channels, so you won't have any trouble finding that once that comes out. But that'll just be an easy way for you to have something in your hands while you're working on stretching your horses that you can refer back and forth to, instead of, oh, that's really nice, instead of having to pull your phone out, turn it on, go back to your screen that you were looking at and all that stuff. So that'll be available as a combo with the stretching course, or you'll be able to buy that separately as well if you so choose. It's a good boy. His pelvis feels really, really nice. I'm gonna flex him around to his shoulder, see if he can touch my hand where I'm pushing. Again, nice and slow, easy. Let him kind of figure it out. Good boy, good boy. Good boy, good boy. There you go. There you go. Good boy. Good boy. That's a good boy. Awesome. Good. So you got to give the new horses time to figure things out instead of just forcing them and rushing them to do what you want. because then the next time you go back and ask them to do the same thing, they'll remember that. And it's really important when a horse does something good that you give them time neurologically to integrate training, and you give them something to eat or you let them graze. That really helps to solidify that memory that what they did was a good thing, and they'll remember how to do that quicker the next time, and they'll also remember that for a much longer period of time. Versus if you're pushing them and stressing them and forcing them, that's going to be in their short-term memory. They won't remember that for very long. But you give them time to integrate, especially if you have the ability to let them graze. They will put that into their long-term memory, and they will remember those things for a much longer period of time. So I got the sun is blaring on the camera. So good morning, everybody. Thank you for coming on to my live. If you guys don't mind hitting that like button for me, I would greatly appreciate that. And if you feel like you'd like to subscribe, that would be amazing as well. So I'm going to check his pole here. And right off the bat, I can feel he's tighter on the right side than the left side. And all I'm doing right now is I'm just filling the space, the size of the gap between the back of his mandible and what's called the wing of the atlas, or the lateral border of his first cervical vertebrae. And I'm just feeling that space, and it's a lot tighter on the right side than it is on the left side, and it's nice and pliable and soft over here, where it's very tight and hardened over here. So I'm going to try to stretch this out. I got a little hair in my mouth. And he might fuss a little bit with this one, but we'll just take it slowly and see how he does. Because this is a more sensitive spot to adjust, I like to use the meaty part of my hand, so I'm just using the heel of my thumb to apply pressure to my contact point. And that way it's as painless and as comfortable as possible. Oh, there we go. Good boy. Oh, get the hair out of my mouth. So after cervical adjustments, it's always a good idea to give them a couple of minutes. There we go, you got some licking and chewing going on there. Awesome, big deep breath. That's perfect. So that's just a big stress relief right there. So it's a great sign to see. It's, you know, when you have a horse that licks and chews after you do something, it doesn't necessarily mean that you fix the problem, but it definitely means that you reduce their stress level, right? And if you're in pain and something's hurting, it causes you to be more tense and more stressed. So the fact that he just took that big deep breath and it was licking his lips, for horses who tend to be more in that fight mode, and when they're in a fight or flight mode, their bodies don't repair, they can't rest, they don't sleep well, they have gut problems. So it's a really good thing when you can get them into that parasympathetic rest and digest mode, for a whole bunch of different reasons, but primarily because their bodies can heal, they can better digest their food, they get better sleep. Obviously, all things that are super important for a healthy horse. That was great. All right. Ooh. So he's a little sensitive. I've had to pull also. So when you hear of a horse's pull, somebody saying the horse's pull was tired, the horse's pull was out, which I hate that term, out. The pull refers to where the skull meets the cervical spine, or where it meets the neck. So we're talking about the occipital bone of the horse's skull, where it meets the first vertebrae, also called the atlas. So we call it the atlanto-occipital joint. That's what we're talking about when we're saying the pull. And the primary motion that occurs at the pull is lateral flexion. So in a person, lateral flexion is this, ear to the shoulder. In a horse, lateral flexion is this, ear to the shoulder. So the primary motion that occurs here at the pull is this. So if they're not willing to break over and to bring their head around like this, then I know that I have an issue at the pull. There is some flexion and extension that occurs there as well. No joint in the body only has one movement. They have a primary movement, right? Like the knee, primary movement of the knee is flexion and extension, but there's a tiny bit of rotation that occurs in the knee as well. Otherwise we couldn't do this, you know? So, but every joint has a primary motion. Primary motion at the atlanto-occipital joint is that lateral flexion, which is ear to the shoulder. Good boy. So I'm going to check that extension at the pole and see if he's comfortable. And I'm not necessarily looking for him to come all the way down on my shoulder.